Hi, my name is Mickey, and I'm going to demonstrate to you how to properly administer humidification on a patient via a large volume nebulizer. So what we're going to do first is we're going to look at the patient's chart. We're going to look at the chart order, the doctor's orders, the reasoning for the visit of the patient, any vitals, and any vital trends. So an indication in regards to why they would need humidification would be a bypass of upper airway, and therefore they're not receiving the proper humidification and moisture exchange. Another indication on why patient would receive humidification would be upper airway edema. And today's patient is that they're having thick, dry secretions. Therefore, we want to provide humidification to help bring up and moisten that mucus to help it, so they could go ahead and bring it up and cough it out. Okay. A contraindication by providing this humidification is that it could lead to hyperresponsiveness on the patient, therefore could lead to bronchospasms. So before you want to go into the room, you want to make sure that you have your proper equipment. So in this case, we want to make sure that we have our stethoscope, our O2 set, and we want to provide the patient with a towel or napkin so in case they cough. Okay, the aerosol mask, your gloves, hand sanitizer, the water trap, and the correlated tubing. Okay, so before I go into the patient's room, I'm going to use 3 mLs of hand sanitizer, or unless you're near a sink, then you want to go ahead and wash your hands. But since I'm using the 3 mLs of the hand sanitizer, I'm going to rub for at least 15 seconds or until it's completely dry. I'm just going to go ahead and put my gloves. Okay, and I'm going to go ahead and go into the patient's room.
Hello, come in.
Hi, my name is Nikki, and I'm a student at Hartnell College. I'm a respiratory care student at Hartnell College. Can I have you state your name and your date of birth, please?
Yes, Diana Ivy Sandio, 9/21/92.
Okay, do you prefer to be called Diana or Miss Adeno?
Diana's fine.
Okay, thank you. Can I check your wristband?
Yeah.
Perfect, thank you. Okay, perfect, thank you. So, Ms. Diana, it looks like you're having some dry secretions, is that correct?
Yeah.
Yes, okay, so what I'm going to do is, it looks like the doctor put in an order for a large volume nebulizer, and what that is, it's going to provide humidification. And so the aerosol, there's some aerosol particles that are going to go into your lungs to provide humidification and moisture to help moisten that mucus, and that way it could build up and you could be able to cough it out. Okay, and get rid of that mucus.
Okay.
Is that okay? Mm-hmm. Okay, before I provide you with the humidification, I do need to check your vitals. So what I'm going to need to check is your respiratory rate, your oxygen, and I'm going to need to listen to your lungs. Is that okay?
Mm-hmm.
Okay, so let me go ahead and start off by taking your oxygen, okay? Okay, and I'm also going to go ahead and look at the patient, make sure that there's no accessory muscle usage, and make sure that the patient does not present with any signs of cyanosis. Okay, so the patient is not presenting with either or, so it's good. So if you could just go ahead and place your index finger in here, please. Okay, and just go ahead and relax. Okay, and I'm just going to make sure that her pulse is matching with the pulse on this oxygen. So her oxygen was at 99% and her heart rate was at 79 beats per minute, and her respiratory rate was at 13 breaths per minute. Okay, so all that was within normal range, okay?
Okay.
And now I'm going to need to listen to your lung sounds as I indicated before. So what that's going to consist of is I'm going to need to listen to the back, and I would be starting in the bottom and work my way up. When I place my stethoscope, if you could just go ahead and inhale for me. After I check your back, I'm going to need to check the front as well. So I'm just going to need to be checking the bottom again, here, 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 and then your neck as well. So that's going to require for me to unsnap your gown. Is that okay with you? Yes? Okay. So at any time, if you feel dizzy or lightheaded, just let me know and I'll stop, okay? I am going to ask if it's okay if you could just turn to your side. Do you need help? Are you
No,
okay?
I'm okay.
Okay, thank you. Okay, go ahead and take a deep breath in. Good. Are you doing okay? Okay. Almost done. Very good. Okay, go ahead. You doing okay? I'm going to go ahead and unsnap, okay?
Okay.
Excuse me. Very good. Okay, last one on your neck right here, please. Very good. Let me put this back. Let me snap it back. Did a good job. Do you have any questions for me so far?
No.
Okay, so I'm going to go ahead and administer the humidification now. Okay? Okay, so I'm just going to attach the correlated tubing. I'm sorry, I'm going to grab my large volume nebulizer. And so the doctor put in an order for 30% FiO2, and you have a little chart that you could use as a guide. So in this case, it's 30%, and we're going to provide, we're going to put the liter flow at 5 to 8 liters per minute. So in this case, I'm going to put it at 8 liters per minute. However, if you do need to increase the liters at any time, for every 1 liter that you increase it, you increase the 4% of the FiO2, and that's also added to the 21% that the patient is already breathing. Okay, so I'm going to go ahead and thread the large volume nebulizer. So I'm going to also make sure that I put this at the 30% as indicated. Okay. To attach the tubing. So when attaching the tubing, you just want to make sure that the tubing does not touch the floor, because you'd want to prevent any bacterial contamination. So I'm going to add the water trap to it. And what this does is that it holds any condensation that may be built up in the tubing, okay? And you want to attach this to the side of the bed on the bottom with the tubing down. So, there we go. then I'm going to go ahead and turn it on. And again, we want to put it at the 8 liters. Okay, and then you just want to make sure that you could feel the mist, or you could also just put it against your shirt and it's going to show the aerosol mist that's coming out. Okay, so you can make sure that it's properly working. Okay, you're going to add the aerosol mask. Okay, Diana, I'm going to go ahead and place this over your head. Okay, just going to put this on here, just like this, so it just keeps moving. Does that feel okay? And I just we want to make sure, I'm going to keep the tubing up here. Okay, we just don't want to make sure, we want to make sure it doesn't touch the floor. You know, we just want to make sure that we keep your safety in mind, okay? And then just so you can know, it might cause, I'll be checking on you frequently because I just want to make sure that you don't develop any bronchospasms or anything like that, okay? And so in this case, 15 minutes have passed and I'm going to reassess her vitals, okay? The treatment is still going. So again, the treatment is still going. Okay, Diana, so I'm going to go ahead and reassess your vitals, and that means I'm going to check your oxygen level again, okay? If I can just have you place your finger, the index finger in here, please. Are you feeling okay?
Mm-hmm.
Okay. Just go ahead and just relax for me. Okay, so her oxygen was at 99%. Her respiratory rate was at 13 breaths per minute, and her heart rate was at 80 beats per minute. All that, of course, within the normal range. Okay, so now I'm going to go ahead and reassess your lung sounds, okay? Okay, you're feeling okay? Okay. And again, it's going to be in the back. Okay, I'm going to start at the bottom and then check the front as well, okay? You could just go ahead and turn over the difference, please. Perfect. Thank you. Again, if you get dizzy, just let me know. Deep breath. Very good. Again. Again. Very good. Okay. Yeah. I'm going to unsnap. Okay. Okay, excuse me here. Okay. Go ahead and snap. Okay, and Diana, I'm going to go ahead and provide you with this towel. If you need to cough, if you could just go ahead and cough into this. Okay, I don't know if you feel the need to right now or not, but I'll leave it here just in case. And the reason that we want her to cough is because we just want to look at the color, the consistency, to see if there's any odor, and and how much mucus or sputum we collect. Okay. Okay. Do you have any questions for me so far? No? Okay, so again, my name is Mickey. So in case you need me, you could just use the call button, okay? And again, you could just go ahead, once you cough and provide me with that sample, you could just call me in and I'll come and check it.
Okay.
Okay? Okay, excuse me. Thank you, Diana. Okay, so I'm going to go ahead and exit the room. I'm going to go ahead and remove my gloves. I'm going to get 3 mLs of hand sanitizer. And then I'm going to go ahead and indicate in the chart that, you know, the 8 liters that I put on the patient on for the large volume nebulizer, if I collected any collection of sputum sample, and how she was tolerating the humidification, if there was any complications, and I'm going to also document the pre and post vital signs. Okay, so this is the way that you want to administer humidification via large volume nebulizer. Thanks for watching.